but everybody has some sort of mnemonic, right, to remember all those bones. So find the first one and then work your way through them. I usually find the scaphoid first because I find it's easiest because remember the anatomical stuff box? If you pull your thumb back, put your thumb in there, then you're on your scaphoid. So if you start there, she likes to play. So scaphoid, move over is lunate. To make sure you're on lunate, flex the wrist, and it should pop out a little bit at you. She likes to trapezoid, and then play pisiform. Pisiform also has that on the anterior side, that little P shape part. So we did scaphoid, lunate, trapezoid, pisiform, and then I go back to my scaphoid, move up. She likes to play tri for trapezium, two, trapezium, what's the other T? Triquestrum, yeah. Yeah. Triquestrum, I don't know, I have trapezium written twice on my sheet. Obviously that's a mistake. So we have trapezium below the thumb, triquestrum, and then she likes to play, try to catch for capitate, and then hamate is right at the end. And remember with those bones too, if you put a little bit of anterior or posterior pressure on them, so just kind of push on them, they'll move. So that's how you know where that scaphoid is, because you put pressure, you know which one's moving, so then you can move over from there to get to lunate. And just continue through there. Okay, that's how I usually do it when I'm palpating. And I often, if I'm ever palpating someone's wrist, I palpate all 8 of them. Because I feel like I have to palpate them all to, I have to go from one to the next. Does that make sense? So those are tough. That is where people struggle. And that book, the Shell Guide book, is really good for explaining them, explaining where they are, and giving you other landmarks. I usually just use the bone beside it as a landmark, but they give you other landmarks to use. So it's really good. Did anybody go and look at that book yet? Yeah? You went to the library and used it? Good. I'm glad someone's at least using it. Okay, so those are the carpals. The styloid processes in the wrist, you have your ulnar and your radial. So if you just kind of feel where the radius and ulna are and then move down till you feel the styloid processes on either side, or stick out laterally. When you're palpating the wrist too, you're going to want to do the full radius and ulna as well. So you get to the styloids, then you do your 8 carpals, and then you can do your metacarpals. So metacarpals are the bones in your hand. So you have the first one, starts here, comes down. Hope everyone can see that. This is first one, second one, third one, fourth one, fifth one. Okay, those are pretty easy. People find those to be not too bad. And then your phalanges, those are super easy, right, in your fingers. You have your proximal, distal, and middle. Okay, except for in the thumb, you just have proximal and distal. 2 phalanges. Okay, I think that's it for bones. Anybody have anything else? Okay, then articular. What do we have for articular in the wrist? Yep, so in the fingers you have your interphalangeal joints. Those are super easy to find, right? They're basically your knuckles. Just make sure you know which one you're on, the proximal or the distal, dip or pip. Okay, if it's closer to your body, it's proximal, away from your body is distal. Good, what else? Good, your MCP joints are metacarpal phalangeal. Those are basically your big knuckles of your fingers and then your thumb. Okay, so again, super easy to find. You want to make sure you're sort of palpating all sides of it. Because if they just injure it on the one side, you might miss it if you're just kind of going top and bottom. Palpate all the way around all of those. Good. What else? What more specifically in the wrist.
The RCL and the UCL?
Yes, exactly. So RCL is from the radius, so it's on the lateral side. So it's like right here. Okay, find that styloid process on the radial side and just go inferior to it. That's your RCL. Same thing for UCL on the medial side. So find that styloid process and go inferior to it. Okay, that's your UCL. Good. And then in the thumb you have a UCL as well. It's on the medial side of your MCP joint, so it's right in here. Okay, deep in there. Good. Anything else? One more thing. What else do we have for articular in the wrist? Similar to the meniscus in your knee. Anybody know? Yes.
Tfcc?
Yes, TFCC, Triangular Fibrocartilage Complex. So to find that, find your ulna, and it's distal to the ulna. Before the ulna meets this would be pisiform, right in that little gap. So if you find the ulna, move inferior, and you'll feel like a little bit of a gap. That's where your TFCC is. Okay, everybody see that? Like right here. So here's her distal end of her ulna, just in that little gap. Okay, good. Okay, muscles. What do we have in the wrist? Flexors and extensors. Good, so I already showed you that. Extensors are on the more posterior side. That's the big muscle belt. Comes all the way down to the wrist. Flexors are on the anterior side, all the way from the elbow to the wrist. Okay, what else? When you're doing fingers and hand or wrist, you want to palpate this. It's on your hand.
The thenar and hypophysis.
Yes, exactly. So thenar is this bulk of muscle on the thumb side. So right in here, that's your thenar. And then on the pinky side is your hypothenar. Okay. Basically just the bulk of muscles in your hand. And then you can palpate it's called the palmar interossei. That's just sort of the connective tissue that kind of holds them together. So you can just palpate that through the palm of the hand. Good. Okay, any questions? Is there anything you want me to go over again?